Welcome to the webinar on developing person-centered outcomes. My name's Jon Ralphs.
My name's Jo Harvey.
And we're both from Helen Sanderson Associates. Within this webinar today, we're going to talk about three things. First, we want to explore the issues regarding developing our outcomes. Secondly, we want to show you two ways how to address any problems when you're developing outcomes. And finally, the third thing we'd like to show you is how to record outcomes within a support planning format. So I'm going to hand over to Jo now, where she's going to give you a bit of background and information about outcomes.
Thanks, John. Okay, so I think in services, and many of you, I guess, have worked in services a number of years, we're great at measuring activities and processes, and we have lots and lots of ways that we actually make those things happen. So we've got standards like CQC and Ofsted quality assessment frameworks. We're great at counting numbers, but usually that's about numbers of people that might have plans or time for interventions or numbers of interventions. We have lots of information about costs and average costs of support, and we also are great at collecting information around how satisfied people may be. What we're not good at, though, is measuring whether people's lives are really, really improving. One of the things that putting people first was really, really clear about is if we are going to measure the success of social care and also health, we need to have a better focus on outcomes for people, real outcomes that are related to what people want to do. And then we measure whether what we're doing in social care and health is actually helping people achieve those outcomes. That's a much better way of looking at success.
That's great, Jo. So what it sounds like is we're good at measuring, but we tend to measure activity and we tend to count a lot. But what we're not good at is actually focusing on the person, what the person's outcomes are. And that seems to be the main difficulty around that. Do you want to tell us a little bit more?
Okay. So I think there really are two things that we seem to have most difficulty in when we're actually developing outcomes that are really, really person-centered. And the first one is that we have this tendency to embed the solution into the outcome. And we do this, I think this becomes part of our practitioner training. I have a nursing background, and certainly as part of my training, I was very much told I would be an expert in a situation, and it was my role to fix a situation as far as possible. So it's very easy with that kind of mindset to jump straight to having a solution without really understanding what it is a person wants to achieve. And that's one of the difficulties that we get into, I think.
Okay, Jo, that's the first difficulty or the first thing we need to address. What's the second?
I think the other one that seems to me to be the main problem as well is that we're not specific enough when we actually develop outcomes, which then makes it really hard to measure those outcomes. How you can describe, thinking about a conversation I had with a social worker only a couple of weeks ago, who said, so therefore my outcome of being more independent isn't good enough. And that's a great example of this, because how can we measure that? We don't know what that means. That's not as specific enough to an individual to understand what independence for that individual would mean, and therefore be able to measure whether we've been successful in helping somebody achieve that. So that, I would say, is one of the other difficulties that we have.
Okay, Jo, so you've described two difficulties about developing great outcomes, but what does make a great outcome? Okay,
then. So I'm going to take you through a number of things and some definitions, really. But the first thing I always think about is these three questions, really. When somebody talks about an outcome they want to achieve, ask them and ask yourself, does it keep something that's working, or does it change something that isn't working, and or does it move us towards a future that we want? If it's not doing at least one of those things, I would be asking why. Why is this something that we're looking at? Is this actually an outcome that's really relevant to somebody? So that would be the first thing that I would say, really. So just want to do a couple of definitions, really, for you, just to look at this in a bit more detail. So, a person-centered outcome. I've been exploring this for a number of years, having written support plans for a number of years. And really, my thoughts with my colleagues really have come together on this in the last 6 months. And that comes from having done some work around NLP, or neuro-linguistic programming. And one of the things about NLP is that you always know what you want. In any situation, you always know what you want. You know your outcome. And we have a number of criteria that make a really good, what we would call well-formed outcome. And I've taken that learning and applied it in this situation. So here's just a couple of points from that criteria that I think help us decide whether it's a good person-centered outcome. So it must be personal, not expressed from a service perspective. So we hear a lot about outcomes in social care, the 7 outcomes we used to have, and in children's services, the 5 Every Child Matters outcomes. But they are very service-led. They are very much from a service perspective. And if it's a person-centered outcome, it's something that's personal to the individual and or their family. It's something that you have influence and control over. We can't be setting outcomes that are not within the control of the person or those supporting them to be able to initiate some action on or take control of in some way. And it must also be really measurable and specific. And that's really, really important. And all of those things make that a really well-formed outcome. Also, an outcome may have an obstacle in the way of achieving it, which is why it's something somebody wants to look at. So that's another sort of thing to add to that definition, really. And just before I move on and start talking a little bit more about some of the ways that we can look at outcomes, just also want to mention solutions and just separate those two definitions. So a solution is the resource you need to achieve your outcome. It can be an item or an activity, and it may have a cost associated with it, but it also might be free. So it's the means by which you achieve the outcome.
That's great, Joe. So it sounds like sometimes we get a bit confused or muddled between the difference between an outcome and a solution. Can you tell us how we could perhaps sort that out or separate the differences between an outcome and a solution?
Yeah, of course. So I think there are a couple of tools that we want to show you today that could actually look at some of that. The first is a set of questions, and again, these come from the work that I've done in NLP and are helpful to really, I think, drill down to what is the main issue for a person. So if somebody comes to you, or as part of the planning process, says, oh, this is the outcome I want to achieve, just stop for a minute and say, okay, if you got that outcome, what would it give you? What would it do for you? What would it make possible for you? And those 3 questions, you can keep asking them, and as people give you the answer, you will start to get to kind of the real issue, really. And I think they're great questions just to what I call peel the layers back. Also, another great question would be to ask where, when, and with whom do you want it, if that's relevant to the issue or the outcome that somebody's talking about. And that can help you get really, really specific. And in a minute, we're going to show you some examples around that. But there's a couple of other tips, really, around helping us write and develop really good person-centered outcomes. And we've been debating this within our community of people who are involved in the world of person-centered practices. And one suggestion has come from a number of colleagues across the world, really, that have said it actually can be really helpful to write your outcome as if it's already been achieved. And that's something that makes it much more compelling. Certainly from my experience with NLP, it's something that talks to our unconscious mind in a lot more detail as well. The other thing to think about is that we write something as positively moving towards something we want to achieve rather than away from something you want to avoid. And as I said, we're going to give you a couple of examples of this in just a minute. So they would be, I think, the main tips that I would give around, or the main questions that you can ask around that.
Excellent, Joe. So it's, It's what it gives you, what it can do for you, and how it makes it possible for you, and some really great tips there. But yeah, absolutely, it'd be great to hear some examples just to help me with that learning. So could you share some for me?
Okay, I've got 3 different examples to show you. So, first, I need a car. Now, this is something I've heard a number of times in planning sessions. So if somebody said, oh, my outcome is to have a car, the questions you could ask then. So what would it give you? Will it give you transport? What would it do for you? Well, let me go and visit my friends once a week and do my shopping on Fridays. And what would it make possible for you? Spontaneity, allow me to give other people a lift, feel equal to other people. And I'd probably ask again, so let's talk about these friends that you've mentioned. Who's that with? When would that be? Where would that be? Just to give you a bit more. So maybe this could be the outcome. If you've asked those questions, that actually this person is saying, I visit my friends Liz and Anna once a week and I do my shopping every Friday. And you can see that we've written that as if it's already happening, just to make it more compelling. So that could be one example of an outcome. So 5 hours of speech and language therapy, again something you hear quite commonly around a lot of therapies really. It could be physiotherapy or maybe hydrotherapy, but for this example it's speech and language therapy. So what would that give you? Time with a speech therapist. What would that do for you? Help me be more easily understood by my friends. What would it make possible for you? Friendship, social activities, feel confident around other people. So the outcome could be I'm understood by my friends and I can play with them at the after school club every day. You could even phrase that I am playing with them at the after school club every day if you wanted to really move that into the it's already happening. And then I've got one more example, and this one's off something you often see a lot in support planning. And again, a personal assistant, so people might describe having an outcome to have a personal assistant. So the questions to ask, well, what does that give you? That's someone to help me. What does that do for you? Help me wash, dress, go out, eat, move, etc. What does it make possible for you? A life, I could go to work, see my friends, feel equal to other people. So here's a couple of outcomes I pulled from that information. So we've got, I do a paid job 3 days a week and I have the right support when I'm at work. And you can see how we've been specific about the days there. So it's really key. You can count if somebody's actually working 3 days. And or I go out with my friends to the youth club on a Thursday evening. And again, you can count that because you can say how many times is a person actually going? Are they going every Thursday? So that's just some examples around using the questions, which was the first thing, the first tool really that we wanted to show you as a way of helping develop more person-centered outcomes.
Jo, questions sound really great, and they really do help us separate the difference between a solution or an idea and an outcome as well. But you mentioned there was a second way to overcome these difficulties. What would that be?
Okay, so this is going back to an old favourite of ours as well in Helen Sargent Associates, and that's using the important 2 and 4 tool to check if the outcome is really person-centered. So that's not looking at the information you've already collected around what's important to people and what's important for them for their health and safety, but just using that tool specifically around each of the outcomes or the issues you want to address. And that way we can make sure it's truly linked to what's important to somebody, and it takes into account what really good support looks like from their perspective. So I'm going to again show you just a couple more examples here. So this is an example from somebody called James, and James has a spinal injury. And one of his really key issues when we did the working, not working together was that he wanted to improve his fitness and stamina. Now that's not a detailed enough statement for us to be able to measure that really, and to measure how successfully we can support James to do that. So we needed to get a little bit more detail, but I wanted to make sure that it was really relevant and made sense and stayed connected to what James said was important to him. So firstly I asked him, okay, about your fitness and stamina, what is important to you? And he said these things. He wanted to be strong enough to use a manual wheelchair all the time. He wanted to be able to do more than one thing per day without getting too tired, because he was often having to go to bed in the afternoon if he'd done something in the morning. and he wanted to not be so tired that he couldn't go out with his friends in the evenings. So those were the things that were really important to him about his fitness and his stamina levels. The things that were really important for him around his health and his safety really was to improve his general health through exercise, which is something we all know is really, really good for us anyway. But also there was something about his mental health, his well-being really, and that was about not getting socially isolated because he was too tired to go out and see family and friends in the evening. James was 26, all of his friends were working full-time and therefore only met up in the evenings, and if he was too tired to go out in the evenings, that meant he wasn't getting out and seeing people and was getting isolated. So then what's really important is that we pull both of those elements together and try and develop an outcome statement, maybe 1 or 2 sentences in it, that expresses both sides of that really. So this is what we came up with. I am using my manual wheelchair 12 to 14 hours a day, and James was very specific about the amount of time he wanted to stay in his chair. And I'm not too tired and having to go to bed in the afternoon. I am going out 2 to 3 evenings each week with my friends. So we've written that as if it's already happening and hopefully making it more compelling. You could even go into more detail here and say where are the sorts of places that he was going out, maybe who the friends were as well, if that felt that was relevant for us to be able to measure it. But there should be enough information there for us to measure whether he is achieving staying in his wheelchair that many hours per day and whether he's going out in the evenings. But that also combines the 2 sides really of that. I've got another example to show you just to demonstrate this a bit more. So this is planning with Heather, and Heather has a complex lung condition and a number of other long-term conditions like diabetes, as well as a number of other health issues. And when we were planning her and we were looking at what was working and not working in her life, one of the things that she said was not working was that she is on additional oxygen at 4 litres a minute, and that was provided to her through an oxygen concentrator, which is quite a large machine that plugs into the mains. And what it means is that she isn't able to go out the house because the concentrator is not portable. Because of the level of oxygen she's on, she's not able to take cylinders out. So basically, her need for having additional oxygen at 4 litres a minute meant that she wasn't able to get out of the house. So I explored with her, what's the things that are really important to you about this issue? And she said quite simply, when I'm well, I want to go out and spend time with my friends each week. And then we looked at what needs to happen to stay healthy and safe around this issue. And she said she has to maintain oxygen saturation at above 96% at all times. And that's very clear information from her consultant saying that's what she needed to be able to achieve. So pull those 2 together. When I'm well, to go out and spend time with my friends twice a week and maintain my oxygen saturation at above 96% when I'm out. And you could even phrase that, I am going out when I'm well and spending time with my friends twice a week and maintaining my oxygen saturation at above 96%. But both parts of that are really clearly measurable because you can count whether she's going out twice a week, and also you can monitor what her oxygen saturation is. So that's just a couple of examples to show you how you can use the important 2 and the important 4 tool to be able to measure an outcome.
Jo, I love that because being my background in care management, what I see on the to keep me healthy and safe is that fair access to care or my needs assessment. When I saw James's social isolation, straight away I'm thinking about my needs assessment. But what I love about it is it brings in the person, and again, you know, with nurses thinking about the oxygen as well. Again, it's a very kind of clinical assessment of needs, but also we're thinking about the person as well. So it's a lovely example of how it's almost like a bridge between our needs assessments and being person-centered.
Yeah, and that's exactly why we use this tool to do that, John. That's exactly our thinking behind that was that actually we need to be able to see how the outcomes are relevant to the needs that people have and have been assessed for, particularly support planning. That's really relevant because they will have received money in their budget for those needs. So you've got to show how you're meeting those, and the outcome is the way to do that, really. But this, as you said, brings in that the personal perspective as well, doesn't it?
Yeah, because that can be quite tricky. Is how do you fit an outcome within your support plan? I don't know if you've got any advice around that, Jo?
Yeah, I do. I have got a nice grid. I just want to say now, really, we want to, this is the point where you start to think about the solution. So you think about, you know, what's stopping you from reaching your outcome and what else could you do? Because before we would jump into this sort of straight away. So this is, now you've got that outcome, say, okay, what stops you? And then there's a great way that you can record that. And this we've developed over a number of years, working with a variety of different planners, really. And again, it was, just as you were saying, John, it's about our desire to lay it out very, very clearly for the people who will be agreeing plans. And it can be really helpful for them to be able to see the thread that links all the way through from the assessment that they may have completed right through to the cost of what we're suggesting is a great way of meeting that need. We call that the golden thread, and this outcome grid is a way that I would record the outcomes in somebody's support plan. So just looking at this, this is the Heather example that I've just spoken about. And if you start in the left-hand column, we've got down here an area of eligible need. So in this particular example, actually, Heather is supported now by continuing healthcare, and breathing is a domain on a decision support tool, which is an assessment document. But it's relevant to obviously any social care assessment that would be looking at somebody's health in this way as well. So as we said, the outcome is when I'm well, I'm going out with my friends twice a week and maintaining my oxygen sats at above 96%. So I find it's useful, column 3, I find it's really useful to show the decision makers why this isn't already happening. So let's just be really clear what gets in the way of achieving that. So in Heather's case, it was her oxygen concentrator is not portable. I also think it's really important for decision makers to understand that if we don't do something about that and achieving and changing this situation, there's a risk attached to that. So we thought there were 2 risks that may happen. Heather could decide that she was just going to go out without oxygen, and that could lead to all sorts of different problems for her, like hypoxia or at least a chest infection and being admitted to hospital. Or if she doesn't go out, then again that would really lead to her getting very socially isolated and depressed as well. And for Heather, she does suffer with depression at times in her life anyway, so it was a real risk that that would happen. So then when we started to look at what are the obstacles in the way of this and what could we do about it, we looked at a portable oxygen concentrator was the way that we felt you could move forward, the solution for Heather in this. But then we needed to say, okay, if that's the solution we want to take forward, what risks are there in that solution and how can we mitigate them? Now, we didn't explore a very detailed risk assessment process. It didn't need that level of detail, but because we were able to identify the risk quite simply, so we decided there were 2 risks here. It might break down, so the portable oxygen concentrator could break down. So we felt one way of mitigating that was that we paid for a service contract that was an annual service contract that kept the portable oxygen concentrator in good working order. That would be about £150 a year. And then the other risk we felt was that you might get a flat battery. So what they have in place for Heather's PAs, and she's supported by PAs, is there is a clear protocol that says you always carry a spare battery, so it's up to the PAs to make sure the battery's with them at all times. Plus, there's a protocol that says really clearly that the oxygen concentrator is always on charge when they're in the house, so they know it's fully charged when they go out. So they were the two ways that we thought we could mitigate risk. And then we've just put the cost in, which was a pretty big cost there, as you can see, for an oxygen concentrator, which was £3,500. So that's just a simple way, really, of actually recording outcomes in a support plan in a way that we think links it very, very clearly to the needs that somebody would have been assessed for right at the beginning of the process of them getting a personal or personal health budget.
That's great, Jo. Thanks for that. So it sounds like, in summary, we've explored the issues regarding developing good person-centered outcomes, and we've recognised, we need to sort out the difference between solutions and outcomes and make sure we don't muddle those up. And the way you've done that, or you've explained to us, Jo, is that you showed two ways to address this problem when developing person-centered outcomes. The first way is to think about some questions, and you can ask those questions. What does it give you? What does it do for you? And what does it make possible for you? And that was really useful. But backed up with that, we had a second approach as well, which was using the important 2 and important 4 person-centered thinking tool to really think through some issues and overcoming those problems when defining person-centered outcomes. And then finally, you've shown us how to record outcomes within a support planning framework by using this outcome grid. So thanks for that, Jo. That's been really, really helpful.
Okay, so I would say that's all that we've really wanted to say today, and hopefully anybody listening to this will find this really useful. And my email and John's email is up on the screen now, and you can email us and ask us any questions that you may have as a result of listening to this. So thank you very much for listening.
Yes, thank you.